You're not starting as Sri Lankan way of we are doing. I born to you all. Hi everyone.
Hi.
So we are back with another episode.
Yes, and it was about healthcare
We thought, yeah.
we was thinking about.
So today,
Also, big area
of course, it's a
that
vast area,
that is important for both countries.
and it is one of not one. It's your area.
Yeah, as I'm a doctor, you mean?
Yeah,
Yeah.
since you're a
Yes.
doctor.
Yeah. I don't know everything, but it's kind of a interesting structure anyway, and then you can ask me questions if you want.
Of course. So today, as our way of narration that we will discuss about healthcare in Sweden, the system in place in Sweden as well as Sri Lanka. So first of all, I'll hand it over to Sia. So if you
Yeah.
can shortly brief us, what's the
Well,
basic?
I can start with the overview, if you say so. In Sweden, we have both private and public healthcare systems. And the public healthcare system is free of charge for everyone that seeks the hospitals or the GPs. So in that way, it's a safe system. Everyone pays alike when you have to pay for a small sum for each visit you do. But if, for instance, if you are in hospital, you don't pay anything more than just about 100 Swedish crowns for the food you get. So it's a safe system in that way. And in the private sector, you also get free of charge if you are a Swedish citizen, because the private owner charge the government, the state, the public health system. So yeah, it's quite nice.
So it's actually run by the welfare system in Sweden.
Yeah, it's one part of it.
Biggest part, I think, one of the
Yeah,
biggest.
it is.
Education and health.
Yeah.
So
And security, you also
security.
can say, is a big part.
So when it comes to healthcare, can you tell me about age-wise for the childhood, from the childhood to young and old, how you categorize how they treat in Sweden?
Well, we have it's more categorized by the needs. For children, for instance, we have a certain speciality for children. The or children under the age of 18. And then you have different specialties, as I think you have in Sri Lanka too, as in the rest of the world. You have orthopedics, surgeons, medicine, and like that. So age, for instance, is not anything that we take in part when we decide which kind of care a patient will have. Even if you are 100 years old, you have the right to the same professional care as one that are 40 years old. That's very strict in Sweden, for instance.
So after you get retired, there are special benefits in health for the elderly and for the elderly age, special care like home visit, and nurses are going homes and treating them, checking them from the
Yes, you can say so, but it's not because of the age. We have no limit like over or under 65 for that. We have young people having that care at home.
special care.
Yeah, home care.
Home care.
Visits with both sub-nurses and nurses and doctors also do home visits in Sweden. But of course, they are more complex and more problem the elder you get. And you can still be 55, but you can have very complex needs, so that you need to have a whole team around you for being able to stay at home. And for those that can't be at home, but they don't need a hospital, and we have facilities for those special institutions. A big group of patients are, for instance, those with dementia, growing group, very fast growing group. That's a challenge in Sweden, that we have quite an elderly population. So in the nearest 10 years, we will have 50% more of elderly people older than 80 years. And so even the group with very complex and many diseases, many medicines are growing very fast. So that's a challenge for the Swedish society to build so much facilities that is needed to give that kind of home care for those who want to, that are needed, of course. But everyone can go to the emergency clinic and get care.
Are the medicines are free for
Yes, you can say that they are free from a kind of level. We all pay regardless of our income or fortune or anything. So we all pay. I think now it's up to, when we buy medicine, up to 3,000 Swedish crowns, then we have to pay all of it. Then after that, we have 50% less, up to, I think, 1,000 more, and then it's completely free. Yeah.
what will be the expectancy in Sweden?
I think last year, I think the age was for women 84 and for men 83. And the men, the year for men is closing in on women's.
Also, you have immunization and disease control system in Sweden in place, right?
We want all the elderly people to have a vaccine for the flu, for instance, and now also for COVID. That's very important. And then we have some programs for other kinds of vaccinations too. And of course, for the young, from them up to 2 years, they are in a program that gives them vaccine against the ordinary, dangerous, child diseases.
Okay. So mainly also there's a vaccination in place in winter as well, right? For elderly and children especially.
Yeah, you can say that the vaccination program starts about in October, because in Sweden we have the top of the flu in January, February, you say. So it's good to have the vaccine 1 or 2 months before.
Okay, that's a Swedish system in place. You can also write comments and ask more question in the comment
Yeah,
section
do that.
from Sia. So if I may talk about Sri Lankan system, we also have public and private systems in place. It's similar to Nordic and Scandinavian systems, if I may say. We have free healthcare system in Sri Lanka, which mainly benefited through the taxpayers' money. And of course, we have again vaccination systems in place from the time of birth until the age of teenage and also elderly. Also, there's a private sector of health as well. That's actually a profit earning sector, which you can get good service, and sometimes you don't have to be in queues for operations, or there are things that you can, if you are okay enough with your financial systems, you can pay and go into private hospitals and get treated well. And also we have Ministry of Health, which is controlling all these medicine imports and implementing of health system and everything in place via the health ministry. They are actually controlling and monitoring all the aspects with regards to health in Sri Lanka. We have a good state healthcare system, but of course we are lacking in rural areas in terms of hospital facilities when it comes to government hospitals. Also, we have practices of sometimes producing good doctors, and they have been really good through the system that they produce really good doctors to the healthcare system in Sri Lanka. They have a bond with the government because they are produced by through the free education of the government. And if when they start practicing with the government hospitals, they need to sign a bond that
Okay.
they can't leave the country. They have to practice this much of period.
Yeah.
And of course, but our doctors have been in around the world treating and giving services in Western countries as such. And also we have good system in place for children to monitor their health. But of course, we have issues in, terms of how, past few years and even in the history, how we as a government, as as leaders, how they have actually put weight on this area.
Okay.
There are questions that to be asked and answered, but I don't want to speak on that because overall, the picture in Sri Lanka, we have public and private healthcare systems in place, and of course, we have good doctors. I think in Sweden, you are having an issue with doctors and nurses.
Yes.
The number of doctors and nurses
Yeah.
that you need.
Yeah, it has been so for the last 6, 8 years. The lacking of nurses and also doctors in almost every areas.
So you have a chance if you are a Sri Lankan doctor or
Yes.
nurse, you can try to come to Sweden as a profession, a nurse. But there's a small hiccup. You need to learn the language as well first,
Yeah, that's right.
pretty much. But
Yeah.
I don't tell that you need 100% to be precise. But I think Sia can tell that you need the language in.
Yes, that's very important. And by the way, you can start learning Swedish now there are several different apps, so you can learn it before, and I think it's a bit easier for you to come to Sweden and stay from the beginning if you can show that you already has started learning.
That we have a brain drain in Sri Lanka. I'm not actually encouraging the brain drain in Sri Lanka because doctors and nurses are going away from Sri Lanka. We also need
You also need them. Yeah.
doctors because the
Yeah.
products of Sri Lanka, the best products of Sri Lankan
Yeah.
education system and so on and so forth. But if you are looking for a opportunity elsewhere,
But a huge part of the Swedish doctors that are now specialists and working are immigrants or coming from all over the world, not only Europe. So I think it's up to 40% of all Swedish doctors come from some other country.
non-EU countries,
Non-EU.
out of EU.
Non-EU. Yes, yes. Sorry.
So that's
I
why.
thought it was a Sri Lankan word.
No, none you. So maybe I pronounced wrong. So that's it. I hope we hope that you have gained something, an idea, overview of the healthcare system of Sweden as well as Sri Lanka. You can look into that as well if you are an enthusiastic person of healthcare systems of the world and the countries. So you can look into Sri Lankan healthcare systems as well because most of the foreign doctors are coming to Sri Lanka to study
Yeah,
and observe Sri Lankan system as well
that's good.
because that happens. And yeah, so I hope that you have gained much knowledge with this episode. What do you need more to add? See, you have anything to add?
No, you can talk a lot about
Yeah,
healthcare
it's a huge,
system.
huge
Yeah,
subject.
we also have problems in Sweden that we are trying to struggle. One is that the queues are long for some kind of operation.
Operation, same as in Sri Lanka.
Yeah, but we also prioritize, for instance, everyone with some kind of cancer
You prioritize.
always goes first in every queue. So, yeah.
Of course. So that's it for this episode then. Hope you have enjoyed. Hope you have gained something. So thank you for following us. Please subscribe us and please give us your ideas and thoughts. We love them. We look at those things and we expect those ideas and we need to grow this channel as well. We are hoping and we need your support. So just follow us. Thank you very much.
Yeah. Thank you.
Bye
Bye
bye.
bye.